Welcome everyone to Beyond Skin Deep. Today our topic is injectables and skin treatments and why you should never do the two without each other. I'm Katie J. I'm the medical esthetician at Austin Plastic Surgeon Med Spa, and today I have with me gorgeous
Sarah Mack, and I am the nurse injector at Austin Plastic Surgeon Med Spa.
So the reason we want to talk about this particular subject is because we have so many people coming in and choosing one or the other.
Absolutely.
And I think, Sarah, I'll let you kind of kick it off and talk about what you kind of see in the treatment room.
So, typically on my end, whenever we have somebody come in for a consult, they're pointing out things they notice about their face. So they're saying, I have these recurring wrinkles due to these repetitive movements. I have some mid-face volume loss. I wish I had larger lips. Whatever portion that they're talking about, sometimes a combination of several. I can address with Botox or filler. But then shortly after, they'll say, oh my gosh, I love it. And I also see my pores, my scarring, things like that. And then that's when I'm able to, kind of pass them over to you and let you do your thing. And I know when you're doing facials and stuff like that, you get the same questions on the other end. So naturally, to your point, it's almost a disservice to do one without the other. I can fill you, I can immobilize those muscles to prevent the wrinkles from reoccurring. But at that point, that's kind of where you take over to work on texture and things like that.
Yeah, exactly. I think one of the major things that people notice is we do a lot of before and after. So we like our clients to see that immediate result of filler, Botox, their skin treatment, dermaplaning, whatever it is that we do. So when clients look at before and afters, and I think I notice this more when I'm in the treatment room with you and we do the fillers and the Botox, is that they'll see their lips and they'll love them. And then they'll go, oh my gosh, is that my pores? Is that what my skin looks like? And they'll freak out and they immediately want us to filter it, which, we can do a little bit, but we don't want to adjust it too much because we're trying to show the before and after of your work. So that's really where I come into play then, because I can talk about what it is that we can do. So we kind of want to talk about skin treatment pairings, and I'll let Sarah kind of start out and talk about the things that she does for clients. And then I can let you know and jump in with what it is that I like to do to enhance the results that you're getting from your Botox and your fillers.
Right. So the most common, most well-known thing I feel like that's out here is Botox, just a neurotoxin. Basically how it works is it just inhibits that muscle from contracting over and over again. So, expression lines, things like that, mainly forehead wrinkles, crow's feet, all those wrinkles that we get over time from doing the repetitive movement, we can essentially temporarily paralyze that muscle, just kind of with the thought of like folding a piece of paper. If you fold it over and over again, you get that deep wrinkle. If you allow it to relax, then that wrinkle smooths back out. So that's the thought with it. And it does wonders for people. I mean, people, first time Botox clients come in and, call 2-3 weeks later and are, shocked that we were able to get those results. However, people that have had, those deeper lines for a while still end up with a faint line. And they want to know now, what can I do about this? So.
Exactly. And that's usually when I come in and kind of take over for them. So there are many different resurfacing and retexturing treatments that we can do for the skin. Okay, so when I look at someone, we're going to look at what it is that's bothering you most. So if you come in and you still see a faint line, or you're just seeing maybe it's more crepiness or dehydration to the skin that Botox really can't address, then we might look at doing something like an Aqua Gold treatment, specifically for people who say, I just hate the way my pores look. Pores is like a number one thing that I hear outside of pigmentation from people that they just absolutely cannot stand. Well, there's nothing we can do. We can't get rid of pores. We need them. They're actually very important. But here's what we can do to reduce the size and what I like to do in pairing treatments. The first thing is that I would have you probably see me first and then go to Sarah for your Botox appointment. But we would do a dermaplaning. We would do a hydrofacial, just a great exfoliation, deep cleanse, and infuse your skin with really good ingredients that you need. And then kind of the red carpet treatment that I like to provide for people is we do something like that and we end it with an Aqua Gold. And Aqua Gold is baby neurotoxin for the face. And we actually even take hyaluronic acid filler And then I have a mix of other ingredients that, depending on your skincare needs, whether you need brightening, skin clarity, peptides, growth factors, I will create a custom blend for you. And then we infuse it into the skin, and it's a tiny little device. It's a dermal infusion type device. And we stamp this baby Botox filler and concoction that I've created into your skin. And what it does over 7 days is it shuts down that oil production. So you get this really gorgeous glow. Your pores shrink. That hyaluronic acid that we really actually make it very fine so that it can actually get into your skin, actually rehydrates the skin and plumps it. So I can go up underneath the eyes in areas where you feel like maybe you're lacking a little volume, or the texture's gone a little wrong texture. We always notice that first under the eyes. So with Aqua Gold, it actually smooths it out. So between Sarah's Botox treatment for you, which kind of immobilized the muscle, stopped it from moving so much, helped to refine that area, I can go in and like Photoshop you with Aqua Gold. And that's really what it is.
I had it done myself, and I couldn't believe it. You know, the first couple days, it takes a little bit to work. And then at about that week point, I remember putting on my makeup for the first time, and I was like, oh my gosh. Like, I could noticeably tell my pores were smaller, my skin was softer. And so, to our point, the Botox in conjunction with Aqua Gold is an amazing, amazing treatment.
Yeah, it's game changer. And then keeping that skin turning over. You know, everyone is doing some level of exfoliation treatments, and those are just important because you need cellular turnover. The whole goal for a hydrofacial or diamond glow or microdermabrasion or dermaplaning, any of those treatments, oxygen facials, the whole goal of those is to get that skin to turn over quicker, because as we age, cell turnover slows down. I hate that story, but it's true. So we can actually trick our skin into thinking that it's way younger than it really is. So we can make it think that it's about 20 years old, because in our 20s, it's still turning over every 4 weeks. And that's why that skin at 20 years old is so beautiful. But at 39, we can continue to make it look like it's 20 years old if you continue to turn it over. So that's why we would do those type of treatments. And those pair well with anything that we do.
Yeah, for sure. To your point a few minutes ago, I think another question that we get all the time is, if I'm going to make an appointment with both of you, which one do I need to do first? So you touched on that, and I think it's important that they know to see you first and then come see me second. But we're happy to do it all in one day. So they can come see you for, you know, an hour, hour and a half long of facial treatments, and then come see me for, you know, a 30, 40-minute filler treatment. And we can get all of that done in one day.
Yeah, and I think that's people's favorite, honestly.
Yeah, I mean, I think it's a great thing we're going to be able to offer here at the new office is you can come in, knock out your appointment, even get a consult for a breast dog or something with Dr. Johnny Franco if you'd like to do that as well. No, we get that all the time. People are always like, also, what can we do about this? And we're like, let's book you with Dr. Johnny Franco. So it's going to be a kind of one-stop, come in, get everything taken care of, and then, you know, we can see you a few months later. So I think it's going to really help on making those several appointments and things like that people just hate trying to find time for, right? You can come in, get all your beauty treatments done in one day, and we'll see you in a few months.
Absolutely.
Yeah, it's going to be great.
You'll feel like $1 million. So let's talk a little bit about fillers, because first of all, I love fillers more than life itself. We all know this. I just always want more. Every time I see Sarah inject, I'm like, oh, I need that.
Yeah.
And she'll look at me and be like, girl, bye. You have enough. But talk about the fillers a little bit.
So, you know, the most common fillers we get are typically for lips, cheek, jawline. I'd say those are probably the top three. So in regards to those, to start out, you know, the lips help for numerous reasons. Again, as we age, you lose volume in the mid-face and the lips. So by adding more volume, we can reduce the wrinkling that you see, improve some of the texture, not all of it, which is why it's important for them to then see you afterwards.
Right.
You know, but filler is a great thing to just give people that lift and that contour and definition that they want, just to bring a little bit more youthful look. And, you know, when we're talking lip filler, myself and you have gone through several syringes of lip filler. Those that just want something basic, you know, we carry anything from Juvederm Ultra Plus, Restylane Kiss, Versa, lots of different products. So we're really good at picking what product is best for you. 1 ml of filler is not going to give you lips like yours and mine.
No.
So
No, it's not.
what's great about it is we can start you out, with a 1 cc syringe, give it 2 weeks, see how it settles, go from there. Other benefits though to the lip filler is that it also helps draw in, fluid and moisture. So it reduces those fine lines and wrinkling. And then as far as cheek and jawline, which I feel like are now coming in a close second to lips for me.
Yeah, I feel like they are lips.
I know.
It's the new lips. That and the chin, too.
Yeah,
We can't
chin
leave the
augmentation, profile balancing, all of that. So we can do wonderful, wonderful things. And, when you come and see me for an appointment, we numb you with just a topical lidocaine, tetracaine little cream. Leave it on for like 10, 15 minutes. We do your filler and you're out the door in 30 minutes, 45 minutes, even if we want to consult on a few different things. But after that filler has set and settled, the swelling's gone down and things like that, people still will call and say, okay, now that I'm not looking at the volume loss and not, so focused on the, deflation of my lips, what can I do about the lines around the mouth? What can I do about the crepiness on my under eye? And so that's when I think you have a few more treatments that you can talk to them about and kind of make it a whole package.
Right. So there are a ton of collagen inducing treatments that you can do. And when you're getting filler, one thing that you receive a benefit of with filler is that it's actually also giving you a little bit of collagen induction. But in order to make your fillers last a little longer and to get a little bit more bang for your buck, we recommend pairing that with collagen inducing treatments. And there are many different types. Some of my favorites would be microneedling or the skin pen. Okay, microneedling is kind of the gold standard in collagen induction, and even for acne scarring, it's going to really help with that. It's a slow build, so it's something that you do once every 4 weeks with me for 3 months. But what we're doing when we do a collagen in treatment like microneedling is we're building a base for you, a structure that lies underneath that filler to keep that collagen building, growing, because as we know, we lose collagen, so we need to replace that collagen. And so when you do that, it helps to stimulate and grow collagen and help build a base underneath for your fillers. So it will make them last longer. That's one treatment. Of course, another treatment that's super popular right now that I'm obsessed with, which is microneedling RF, and that stands for radio frequency. And that's when we penetrate the skin and then we also tighten the skin with radio frequency all at the same time. So you're getting major collagen induction, you're getting incredible results, and it's like shrink wrap for the skin. It literally like tightens instantly, and those results are very, very noticeable. And then another thing to just refine the texture and again still induces collagen is a good chemical peel. And we can do anything from a light chemical peel so that you don't have downtime to a mid-depth chemical peel, which still shouldn't give you downtime, into a really deep chemical peel. And those we start doing around the fall when we don't have as much sun exposure. It's a little cooler outside, so those of us who suffer with melasma can actually tolerate the treatment. And we can build you on that. And then, of course, there's skincare that goes along with it as well. But doing collagen treatments in conjunction with filler is going to get you long-lasting results, and your skin is going to look beyond incredible.
Absolutely. Yes. One without the other, to your point, is a complete disservice. When we see people come in that combine the two, their results are just extraordinary. So,
absolutely.
I think we're really excited to offer that at the new building and get people in for these duo appointments and create, a longevity, a plan going forward with, whether it's seeing you every 6 weeks, me every, 3 months, and kind of going back and forth until we get people exactly where they're looking to be. Another thing I think that we're looking forward to talking to here in the future is a couple myths. We've brought up Botox, we've brought up, dermaplaning, fillers, chemical peels. And so I think something we want to chat about next here is going to be what's true, what's false, a whole like Instagram versus reality, and kind of what to expect going forward with your treatments with us. So,
absolutely.
Yeah.
Well, we've had fun with you today. We hope you learned a little something. If you have questions, feel free to follow us on Austin Plastic Surgeon Med Spa. You can also follow Dr. Johnny Franco on Austin Plastic Surgeon and kind of come along our journeys of before and after, whether it's surgical or with skincare needs. Our goal always with Austin Plastic Surgeon is to help you love the skin you're in. So we hope we are doing that for you.